Jim is just one of about 6 million people in the United States who understand what it's like to live with atrial fibrillation, or AFib. It's the most common heart rhythm disorder, and it's caused by rapid, disorganized electrical signals that disrupt blood flow to the heart. But to those who suffer from AFib, it often means shortness of breath, heart palpitations, lack of energy, fainting, and a high risk of heart attack or stroke.
Prior to my surgery, I really didn't have a life. Once I had AFib started, it started out slow, and it just kept getting worse and worse and worse. It wore me out. To mow the lawn was a chore after work. Just to get done with a day of work, your mind is cloudy. You just don't function 100%.
Like many, Jim tried medications and even had 2 ablation procedures, but nothing stopped the pounding in his chest. He was beginning to lose hope, and then he met Dr. Joseph DiLiberto Jr., one of the only cardiac surgeons in the world able to perform a new procedure called CONVERGENT.
The CONVERGENT procedure is a minimally invasive approach to cure atrial fibrillation. It's a collaborative effort between the electrophysiologist and the cardiac surgeon, adapting the best of both techniques in a minimally invasive approach to offer cure rates as high as 92%.
Jim became the first CONVERGENT patient in Florida and is now 100% cured.
I'm so thankful with the quality of life I have now. I mean, it's hard to describe how great it is now and how much I appreciate just feeling good.
Historically, atrial fibrillation has been treated with the Mays procedure, which is performed through a median sternotomy, a 10 to 12-inch chest incision where the ribs are divided and muscle and tissue are separated to allow access to the heart. This procedure is hard on the body, requires a 7 to 10-day hospital stay, and a 3-month recovery.
Whereas with the CONVERGENT procedure, I make a 1-inch incision in the abdomen and I put a TV camera in the sac around the heart. And then I take a device that's been specifically designed to burn and create lesions on the outside of one of the chambers of the heart where that electrical rhythm is. At the completion of that, I put just a few sutures because it's only 1 inch long and a small drain in. And then the electrophysiologist goes inside the heart through one of the veins in the groin and basically burns from the inside of the heart out.
With this minimally invasive approach, it's a smaller incision, a 2-day hospital stay, and about a 1-month recovery. Jim was back to work in 1 week, and in 6 months, he lost 30 pounds and was off all medications.
I'm so grateful for them and that they're so blessed to have the gifts they do. It's amazing.
Dale Loftus also suffered from chronic AFib.
I was a ripe candidate for a stroke or a heart attack. Anytime you're in constant AFib, that can happen. And you kind of don't want those things to happen.
He was getting ready to celebrate 59 years with his wife, and he knew if he wanted to see another anniversary, CONVERGENT surgery was his best option.
I did a lot of praying about it, and I had real peace about doing it, and now I know why, because it worked. My quality of life is probably 75 to 80% better, maybe even more than it was before. I'm never in AFib. I've checked it. I check it nearly every day. I can tell by the way I feel, my energy level. To say I'm thankful is putting it mildly. I'm very blessed.
The CONVERGENT procedure is normally performed on patients who have had AFib for a long time, had complications such as stroke, have had intolerance to medications and/or unsuccessful ablation procedures. If you suffer from AFib and are desperate for relief, call Dr. Joseph DiLiberto's office for a free consultation and see why he's a beat above the rest.